And I am the Adrenal Fatigue Recovery Ninja. And I wanted to let you know that we are doing an extension of my critical health care audit. Yesterday, I announced it at the last second. I know a lot of you didn't get a chance to see this offer. I had a couple of messages, and I thought, you know what, it'd be great if I offered it for one more day. So that's what I'm going to do. Some of you didn't like that I used the word you snooze, you lose, and I apologize about that. I know that when we are exhausted and we are burnt out and we've been to one doctor to the next, to the next, to the next, one copayment after the other, lots of out of pocket expenses, maybe we're not working as much as we can. Whatever the reasons, those may be adding to your stressors as well. And certainly it was not my intention to do that. But I did want to give you a little bit of push, a nudge to overcome your fear and realize that this is not an offer that comes along very often. And the whole reason I did it was because I had just gone to a weekend seminar and we talked to a bunch of providers that were billing insurance. In fact, let me tell you this story. It was the professor who actually gave the presentation, and he was talking about how whenever he gets his blood work, he calls up the university that's next to him and he goes over their pathology department, and whenever there's a difficult presentation of findings, the professor goes over it with the pathology department, which is a really cool idea. But then they were asking him, hey, why are you running all these blood tests? And he goes, what do you mean? I need to get all the information. And he goes, yeah, but insurance isn't going to like this. They're not going to want to pay for this. And he's like, well, I don't really care what insurance says. And I really wanted to make that point cross in that when we do blood tests, a lot of the tests that I look at are so devoid of very important variables like reverse T3, T3 and free T3 or T3 uptake, or even beyond TSH and T4, what's going on with the thyroid peroxidase antibodies or the thyroid binding globulin antibodies. And a lot of you have those and aren't being told about that. Or a lot of you have a very bad conversion of free T3 from T4, and no one's telling you. And when you don't look at those relationships, and you don't look at homocysteine, and you don't look at iron panels, and they don't include basic blood values, and your hemoglobin A1C is not on there, you're looking at the ocean like this. Not to mention the lab values are very broad. So it just goes to show you that a lot of doctors don't want to go outside of the non-traditional, outside the box model where they rock the boat and insurance says to them, hey, why are you running these tests? So the test that we're offering in this particular program is about $1,500 worth of testing. We're also going to be able to do an Institute of Functional Medicine timeline. You fill all that out, and I look over it and look at some variables that may not have been told about. One of the other days, we had a consult with a girl who's been getting really bad PMS cramping, and I asked her about all the Advil she was taking, and she said, well, is that a problem? And I'm like, yeah, that's a problem. And the only way we understand that is by looking at your timeline and getting clarity on that. We also have you do a 61-point energy evaluation, which looks at your metabolic health, looks at your brain health, looks at your energy levels, and your nutrition for your brain, and we can really give you some great insight on that. And then basically what I do is I put all of that together and make a recommendation on what you should be doing. There's no obligation to continue. This is just a way for me. It really is a community service. I mean, it's about $1,500 worth of testing. The timeline's about $700. The energy questionnaire is about $495, and then putting it all together and giving you recommendations, another $495. That's over $3,100, and I'm doing it for $695. So it's just my way of helping you guys and trying to give you some insight on what's going on with you and your health, and what you need to be doing or what you're not doing, and what you could be doing, or what you're doing too much of and you shouldn't be doing, or what other tests need to be done that you don't have. I mean, you need this information. So I'm extending it for today. So we are here till 6:30 p.m. Eastern Standard Time. The number is 561-883-0090. And just tell, David or Taylor or Olive, hey, I want to do that critical care audit. I know it's a great opportunity, and I want to take advantage of it. and let's get started. All right, so I look forward to helping you in your adrenal fatigue nightmare. Thank you so much.